the disease but not the deceased. A very good morning to all of you present here. Every year on 1st December, the world commemorates the World AIDS Day. People around the world unite to show support for people living with and affected by HIV and to remember those who lost their lives to AIDS. This World AIDS Day and AIDS is highlighting the urgent need to end the inequalities that drive AIDS and other pandemics around the world. Without bold action against inequalities, the world risks missing the targets to end AIDS by 2030, as well as a prolonged COVID-19 pandemic and a spiraling social and economic crisis. Tackling inequalities is a long-standing global promise, the urgency of which has only increased. In 2015, all the countries pledged to reduce inequalities within and between countries as part of the Sustainable Development Goals. The Global AIDS Strategy of 2021 to 2026 is End Inequalities, End AIDS, and the political declaration on AIDS adopted at the 2021 United Nations High-Level Meeting on AIDS have ending inequalities at their core. But today we know better, and thus we proudly show our support for people living with HIV and AIDS by wearing a red ribbon. The theme for World AIDS Day 2021 is End Inequalities, End AIDS, with a special focus on reaching people behind. The World Health Organization and its partners are highlighting the growing inequalities in access to essential HIV services. On December 1, 2021, the World Health Organization is calling on global leaders and citizens to rally to confront the inequalities that drive AIDS and rich people who are currently not receiving essential HIV services. So, take the lead and pledge yourself to support for World AIDS Day. Let's all stand up and make a difference. Now, I call upon Ms. Golda to introduce the guest of the day.
A very good morning to one and all present here. I am profusely overjoyed to take this opportunity to introduce and welcome Dr. Joseph Chettiar, MD, on this startlingly beautiful morning. I request our dear principal, Sister Elizabeth Jayarani and Miss Sharon to welcome Dr. Joseph with a sapling and a welcome card. Thank you, sister. Thank you, Ms. Sharon. Dr. Joseph is a practicing physician from over 2 decades, is into family medicine and is specialized in HIV/AIDS medicine. He has attained a fellowship in HIV medicine from University of South Florida, USA. We are honored to have you here, sir, to share your precious inputs on World AIDS Day. Thus, without further ado, I call upon Dr. Joseph Chettiar to share his expertise and knowledge with our students. Over to you, sir. Thank you.
Good morning, children. At the outset, I take the privilege and honor to thank Sister Elizabeth, all the staff and other sisters and all the non-teaching staffs, and especially and most especially my little children. I thank you all for having me here. My name is, as Sister mentioned, my name is Dr. Joseph Chettiar. I am here to address on the most sensitive and a very important topic and a very important disease which we all should know when we are now stepping forward into a different leap of life, right? So children are just into your teens and you should be aware, especially because you are the future of tomorrow, and you should know what are the pros and cons, how you should be preventing from getting this illness, and how you should be tackling or handling if anyone who is in contact with you, any neighbor or any friend or any relative or anyone in this place where you have come across with this disease, how do we tackle or how do we handle and how do we treat all these things? In short, I'll explain, and at the end I would appreciate all the children will be circulating a piece of paper. If you have any question, anything that comes into your mind related to HIV and AIDS, feel free to ask, and don't worry about the names. You need not write your names, you need not write your identity. Just jot down your question and we will circulate and we will have a good interaction. Okay? Anything which is there in your mind, just anything. Don't feel shy, don't feel conscious, don't feel anything that why should I ask this, I will be named or I will be kind of blamed or I will be put into shame, nothing. This is the correct forum where sister and we, all of us will be helping you all to sort out whatever questions you all have in your mind, boys, girls, all together. Okay? Now, to begin with, HIV. What is HIV? The full form of HIV. Does anyone know? Yes, tell me. Excellent. It's human immunodeficient virus, HIV. And what is AIDS? Anyone? Yes, acquired immunodeficiency syndrome. Okay, and does anyone know about the difference between HIV and AIDS? Just some hint. Just raise your hand if anyone knows. No? See, like how we have COVID. COVID is a disease, coronavirus. Okay, similarly HIV is a virus, and HIV causes a disease which called as AIDS. HIV enters into our bloodstream. I'll tell you how it enters into our bloodstream, and then it causes some symptoms. There are multiple symptoms which comes together, and then number of symptoms when it comes together we call it a syndrome, like singular and plural. Okay. Similarly, one symptom and multiple symptoms are called syndrome. So acquired means you acquire the disease, and immunodeficiency means our immune system, just like how COVID takes care of, because of the low immune system, we get infected and we get sick. Similarly, HIV attacks our immune system and it causes some symptoms. Now some symptoms as in HIV, there are symptoms like there are skin rashes, you get multiple glands here and there, and you get tuberculosis, which is called as TB, and there is some other illness like herpes, like in Marathi or in Hindi we say Nagin, if you have seen anyone having Nagin. Okay, now these, and then there are other parasitic infections in the brain and in other parts of the body, which will be getting into a little technical details. So these symptoms when collectively come together because of our low immunity system, then the person suffers from AIDS. Therefore, there is a difference. A person who's having HIV is not necessarily he's got AIDS. Okay? He or she is just HIV positive. But when they are sick, when they have all the symptoms, that is the time when we say that this person is suffering from AIDS. Otherwise, HIV just remains as positive. Okay? And now, although HIV has got no definitive cure, HIV, once the person gets HIV, he is positive all throughout the life. Not like COVID, not like coronavirus that once person is infected, after the treatment the person becomes COVID negative. But in HIV that's not the case, sadly. HIV, once it happens, the person remains with HIV for life. You have to take medicines all throughout your life, just like people taking medicine for diabetes, for blood pressure, for thyroid. There are many other diseases where you can control the illness by taking medicines. Correct? Many of our parents, many of our neighbors, many of our relatives are suffering from tuberculosis or you can say blood pressure, diabetes, thyroid. So diabetes and all, like how people take medicines and then they get better, they are under control. Similarly, HIV also remains under control. So nothing to worry about it. Now, coming back to the modes of transmission. How does one get HIV? Anyone? There are only 3 modes of transmission. All other are myths and misconceptions. Is anyone among the last row? Anyone knows how HIV begin? Yes, baby, tell me. Pardon? Infected needles and syringes, yes, number 1. I can't do it.
Now forward, direction.
Come here. I want to know how much you all are aware of, huh? Perfect, very good. Yes, the third one. We can circulate the mic so that there will be little interactions also.
Infected person and also having sexual contact with multiple partners.
Perfect, excellent, very good. You all have left. The most important, I don't want this same thing to be repeated. The last mode of transmission.
Exchange of body fluids.
Well, that comes in the first thing, but it's okay, that is okay, fine. I want you to touch on the most important and the other mode of transmission. Anyone? No? Okay, now I'll just jot it down. Okay? First is called as the heterosexual behavior. That is having sexual contact either with multiple partners or having sexual contact with an infected person. If one person is infected and the other person is not infected, then the person who is not infected is having sexual contact with the infected person that without a protective barrier, then that person can get infected. Whether it's male to female or female to male, either or male to male also or female to female, whatever. Okay. Now, second reason is infected needles and syringes and blood transfusion. Okay, if the needle or the syringes are infected with the HIV virus and if that needle is being used within few seconds, like injection drug users. Nowadays all of us are using disposable needles and syringes. So therefore the chances of getting infected from the needle, from a doctor, from the hospital is very remote. But when you see the drug peddlers, people who are using drug abuses, they are using drugs through intravenous modes. There they share the same needle and syringes. There are a group of 5 people sitting, 6 people sitting together. So we don't know who is infected, who is not infected. fatafat they just load the medicine and then they just inject the drug. So there they get infected with HIV, and not only HIV, also hepatitis B and hepatitis C. Now these are the other viruses which also gets infected through all these mode of transmission which I am talking about. Okay, this happens through infected needles and syringes. Now the third thing is also blood transfusion. Now many times in many medical emergencies you need blood transfusion. Doctor in the hospital will just advise go get 5 bottles of blood or 2 bottles of blood. Now, if that bottle which is being transfused, if that blood has got HIV, then the person who is getting transfused will get infected. Okay? Although now, again because of blood transfusion, the chances of getting infected is almost zero, because just before giving the blood, all the possible tests are being done on that particular packet of blood, where HIV testing is done, VDRL testing is done, hepatitis B is done, malarial parasite test is done, COVID test is done, everything is done in that. So therefore chances today because of blood transfusion is very minimum. Now the third thing and most important which none of you all told was mother to child transmission. It's called MTCT. If a woman is infected with HIV and if she gets pregnant and if she is delivering the baby, now that baby will get infected if the mother is not being given medicines during her pregnancy. Although now it is a successful program, mother to child transmission has successfully reduced to a great extent. Moment a woman gets pregnant, we get HIV testing done. If we find that the woman is HIV positive, we immediately start medicines, and so that the baby is not getting transmitted. Though the woman remains positive, but the baby who is going to come after few months will not be infected because of HIV. Okay, not only because of those medicines which are called antiretroviral therapy, also the woman, we advise them not to go with a normal delivery. She should not be breastfeeding. Why? Because of the breast milk also. The breast milk also has HIV virus. So now, once the baby is coming out, she will be thriving and she will be surviving on the breast milk, correct? Now we all have had our mother's milk, correct? Now that baby we will not be giving mother's milk because that mother's milk can carry HIV virus. Okay, so therefore cesarean section, no blood breastfeeding, and after delivery also the babies are given medicines for almost 1.5 months to be more sure so that the baby does not get infected. Now after 1.5 years of the age of that baby, we test the child whether that child is got infected. When we take all these precautions, the baby is almost 100% safe. The baby does not get infected with HIV. Okay. Now these are the only 3 main modes of transmission. Apart from this, many people, when we come across in the families, when it's a joint family, when people, neighbors, when they come to know that the person is positive, they immediately outcast that person. They immediately ostracize that person. He's HIV, he's AIDS, he AIDS patient, But I told you what is AIDS and what is HIV. Okay? So you need not do that with a person who is HIV infected. Because by routine social contact, sitting in one room, using the toilets, same toilet, if a person, suppose I am HIV positive, I use a particular washroom, I use a particular towel, I use a particular bed to sleep. If that person, if another person who is not HIV infected, if that person is using the same washroom, if that person is using the same towel which I used, if that person is lying down on the same bed where I am lying down, person will not get HIV. You don't get HIV by a routine handshake. Like in COVID, how it was told, social distance. You should not hug. You should just not. You should remain from the away from the person. Fortunately, HIV is a forgiving virus. HIV is not so dangerous, just like any other viruses. Okay, that does not mean that we should go and approach the virus. Okay, but HIV is comparatively less dangerous and less virulent. That's what I mean to say. Okay, so therefore such people, they need a little more emotional support. Such children, such people who are infected with HIV, they will need more of a care. Now I have got so many children who are by birth HIV, because the mothers did not do HIV testing during their pregnancy. They just went to the hospital straight for the delivery. There are a lot of poor people, there are a lot of women who don't take so much care like how your parents took care of themselves during pregnancy, correct? Still, there are multiple pregnancies, there are people who are staying in slums, they are still not aware of the care that they should be taking. Multiple blood tests has to be done. So they straight away come to the hospital for delivery. At that time, we don't have anything. So children are born with the virus. It's too late. So I have got so many kids of your age who are since birth positive. Now, if in any school, if other children somehow come to know that that particular child is HIV positive, because of lack of awareness, the child is being mentally, emotionally, physically tortured. Okay, so in case if you all come to know anyone, any child who is HIV infected, you need not worry. You can play with the child as you all are playing with any other child. You should behave the way you are behaving with any other children. Okay, you need not worry. I'm sure here nobody would be, but in case if there is anything outside your premises, anywhere in this place, wherever you come across, you need not worry. Okay? And the next thing what I would like to say is about the treatment. As I mentioned, there is no definite treatment, but there are multiple drugs now. Many medicines are available with which HIV, as I told, can be kept under control. Now, anyone knows when was the first case of HIV was found out in our country or in this world? No? The first case of HIV was found in US in 1981, when 5 men were having some vague symptoms. Still then HIV was not so much aware. People were not knowing about it. So we found out in US, in those 5 people, all 5 men were positive. Okay. Now let us not get into the details of those 5 men, how we got to know. Now in India, we got to know the first case was in 1986 in Chennai, in May. And immediately after 1 month in June, we found another first case in Mumbai in 1986 in Jaslok Hospital. That was the first case, and after that there was no looking back, and the virus just got spread because at that time there was no awareness, there was nothing taught about, nobody knew what is this disease, and just now a lot of books are there, a lot of conferences happening, and a lot of people are aware of HIV and AIDS. Okay, so this is it, and if there is anything now, I think getting more into detail for your age will be a little too much. Now, if you all have any question, anything related to HIV and AIDS, sex and sexuality, whatever it is, please feel free to ask me. I am here to answer whatever into best capacity of mine. I'll answer those questions. Okay, children? And don't write your names also. We will see if the question is not repeated, then I will try to answer those questions.
Students, you have a paper with you. Please write. Your teachers will come around and you can pass the paper to them. If you have any queries.
The first question is, does HIV virus pass through saliva? The answer is no. HIV saliva does not carry HIV virus. There are other body fluids which carries HIV, like sweat does not carry, tears does not carry, saliva does not carry, urine, the stool, these body fluids does not have HIV virus. HIV virus is there in blood, in cerebrospinal fluid which comes from the spine, and the vaginal fluid, the seminal fluid. Okay, these are the body fluids which has got virus. Saliva does not carry HIV virus. Therefore, routine when we just kiss a child on the cheek, or you just go and hug a child with this, because of the sweat, one does not get HIV. Otherwise, all of us would have got HIV by now. Is that clear? The second question is, drinking from the same bottle? No. No need. And secondly, one more important thing, the HIV virus, if it remains outside the person's body, suppose if there is a blood which is HIV infected, which I keep it here, within 10 seconds the HIV virus dies from the blood. So that blood, even if it touches my hand, after 10 seconds, HIV will not enter our body. Even otherwise also, if the person, suppose if there is an accident case, if the person is HIV, we don't know whether the person is HIV infected or not. We want to go and support that person. If you have any wound in your hand, open bleeding wound, with that open bleeding wound, if you go and touch the person's blood, then the HIV virus can enter through that infected or that open skin. But with intact skin, you put 1 liter of HIV infected blood, HIV will not enter inside our skin. HIV needs an open tissue, open pore. Only then HIV can enter. When on this intact skin of the body, anywhere you put gushing blood of HIV, HIV will not enter. Okay? So therefore, in fact, this drinking from the same bottle, it will not cause HIV. Was AIDS declared a pandemic? Are there any studies going on finding the exact medicine? AIDS is not a pandemic. Pandemic is when all over the world, when the infection is just rampantly infected, then it is a pandemic. HIV is not a pandemic. Are there any studies going on finding the exact medicines? Lot of studies are going on, lot of researchers are going on also bringing up the vaccine for HIV, like how we have for COVID vaccine. HIV does not have vaccine even now. It's over 3 decades now, HIV is there, but we have still not been successful in coming out with a vaccine. Still the researchers and trials are going on in Pune, which is called as National AIDS Research Institute, NARI, where the HIV vaccine trials are going on, but it is still not successful. Medicines, of course, as I told, a lot of medicines are there to keep it under control, but no cure medicines are available. How was the first person in USA got HIV? Yes, that is important. In this we can finish, whatever is over. See, the first person in US who was detected positive, we don't know how many of them might have got even before that, but this was first detected. There were 5 men in US in Los Angeles. They were having sexual contact among each other, like men having sex with men. They are called either homosexuals or gay sex men. Now these were the men who were having sex among themselves. Therefore, because it was discovered in them, it was found that HIV is possible only in people who are having sex with men to men, gay sex, homosexuals. Okay, I'm sure you all are aware of this. So there, in such group of people, we found out that HIV was there because they developed some vague symptoms. So in 1981, these 5 people who were gays, in them it was found, and then from they were again bisexuals. They went home and infected their own other sexual partners and other multiple partners. So it was the first case which was detected in Los Angeles in 1981. They were the gay men. What was the most common symptoms of HIV and AIDS? How can we as an individual prevent it? The most common symptom is after the HIV gets entry into the blood, into the body. First thing is person might get sore throat, a little vague body ache, little vague fever, and they can get some oral thrush like oral ulcers. They can get some kind of rashes on the body, those red patches on the body. These are again common. Anyone who's got sore throat, anyone who's got some rashes does not mean that that person has got HIV. So please be clear, okay? The symptoms are just very common symptoms. So if then in such patients we find out the history. If the person has had any sexual contact with any person who is a source potentially HIV infected, so then we do the HIV testing. Not all of them who come with a sore throat, not all of them who's got fever, we go ahead, we do. Now all of us have had fever in our life. None of the time doctor might have told you to get HIV testing done. Okay? It's all the history that is important. From where did this virus originate? Is it transmitted from an ape or it is only a human originate? Now, this is a debatable topic. Now, it was found in the first time in a chimpanzee, early 90s, where people used to do butchering. People used to eat directly animal flesh in jungles when people used to stay. So they used to straight away eat raw meat. They used to just cut the animals and then they used to eat. So it was found in chimpanzees. At that time it was called as SIV, okay, simian immunodeficiency syndrome. But then in those days there was not much research which was going on, and therefore we didn't know, but it is still a question mark that it has actually originated from there. But as far as I know, it is originated from there, and then from there it has come to human beings. So now this is also how did the first men in US get HIV? Through physical contact or something else? That is not done. This I answered already. This one is still there. Is HIV found in animals too? No. Recently, 2 people were cured from AIDS and HIV in Australia and Britain. How were they cured and what was their treatment? Now these 2 people, it was called a Berlin patient and Australia. Here there was some kind of, the studies are going on that. We still don't know what was the actual issue in them, but maybe initially that must be a false positive report, and now it has come as a negative report. But very few people, 2 of them had shown some symptoms of cure. After taking the treatment, the HIV viral load had almost become 0. So there is studies going on these 2. Even one child also is there who was infected, and then the child turned out to be negative. So some studies are going on. It is still not sure about it. Why has this disease originated? When will it get end? Has it found all means for the disease? Is it have some experiments? I answered. The origination was from the animals, from chimpanzees, and then it was transmitted to human beings. Are there any measures if an AIDS or HIV person wants to have a sexual contact with someone? Yes. It does not mean that the person who's got HIV infected, he cannot have sexual contact or he can't live a normal healthy life. Using a condom, well, I don't know if this is the right place to talk about condoms, but we are all general citizens, so we should know by using a condom, one can prevent getting infected from HIV. Okay? So, a person, there are many couples where only the man is positive, woman is negative, or vice versa. So, they have to live the normal, healthy sexual life. So, we advise them to use the condoms so that the other non-infected person does not get infected for life. Why was the awareness of HIV delayed and how was it controlled back then? What were the response of people when they first knew about this particular disease or virus? Excellent question. As I told, any illness, because of lack of awareness and because of lack of education about any particular disease, the awareness program always gets a little backseat. We feel that नहीं अरे HIV हमारे यहाँ नहीं आएगा. HIV is a disease for US and for all those dirty people. That is the adjective that they use for used to use for HIV. Even when I went for my studies in US, many of my own friends who were doctors, they were kind of ridiculing me. कि अरे you didn't get any other specialty to specialize on. You had to go to HIV. It was back then in early 2000s. So I said, no, I want to study this. I don't know what is going to be the future, but I want to study HIV. So I went ahead to US to study HIV. So imagine much before that, when HIV was just there in our country, people were just not even talking about it because of lot of social stigma and discrimination. So therefore there was a delay in our country. Everything gets delayed. People don't take immediate action. Does HIV has to do anything with periods? No. Nothing to do with our periods. Are there any stages in AIDS like cancer? HIV, this is a very good question again. There are Health Organization has designed multiple stages of HIV and AIDS, where depending upon that stage 1, stage 2, stage 3. Now this is a little topic for the doctors, but it has got multiple stages, and at different stages you have to handle at different level with different medications. Not like cancer, you can't compare HIV with cancer. Cancer is still far more, fast, and it is a self-limiting illness. The HIV is a chronic manageable illness. It's a slow illness where person can live a healthy normal life with the medicines. If we have medicines for AIDS, how long can a person live? The person can live as long as his life is there. If with medications, I have a patient who is now 91-year-old. He was discovered when he was 62 years old. So how many years? Now almost 30 years is this old uncle, old man, old grandfather, whatever you may call, he is alive. And whatever all old age problems are there, that is there. But as regards to HIV, he is healthy. He is the oldest patient of mine who's doing so well. He discovered his illness almost 30 years ago when I had not even taken my degree. He came to me later on, but he is doing very well even now. Can you imagine? So, now people who are infected with the new cases, they too have even better future, better health regards, and better prognosis as regards to HIV. So HIV is an okay, and like any other disease, it is a very safe and well managed illness. What are the symptoms of AIDS? As I told you, I think this question is repeated. The symptoms were, as I told you, symptoms of AIDS are There's something known as toxoplasmosis, fungal infections of the brain and the body, tuberculosis, loss of weight, person having repeated loose motions if the motions are not coming under control despite taking medications, herpes, and repeatedly patient having fever for more than 1.5 to 2 months despite taking all possible medicines. The person is not having proper results of the medicines. That is the time when we dig into it and then get HIV testing done. Okay, if the illnesses does not get better, HIV is the prime test to be done. Is AIDS deadly? No, AIDS is not deadly.
Do you have any other questions?
To everyone present here. We at Nazareth are very delighted today to have such a great, renowned personality amidst us. Yes, Doctor, we are indeed very happy to get your detailed and useful guidance on this chronic, potentially life-threatening disease called AIDS. It was truly an enlightening session for all of us. You have enhanced our knowledge on this issue, which is definitely the need of the hour. Myself, Mrs. Carol Sequeira, on behalf of Nazareth Convent High School, extend a hearty vote of thanks to Dr. Joseph, who spared time from his busy schedule to grace this occasion. Today we had a wonderful opportunity to hear your thoughts, Doctor, and this will surely help us to end inequalities and to work towards eradication of this disease right from its roots. I also take this opportunity to thank our dear principal, Sister Elizabeth Jayarani, for organizing this very apt program and creating an awareness among us on this World AIDS Day. Thank you, sister. Thank you, doctor. God bless you tremendously for your future endeavor. Once again, a loud round of applause. Now, doctor, please note down Nazareth's name in your list. You will be called often. You have added a feather to Nazareth's cap. Thank you for that. God bless once again.
Can I get it by touching someone? Can I get it by kissing someone? Can I get it by a mosquito bite? Can I get it from swimming pools? Are you confused? Don't be. HIV isn't that easy to be contracted. The 5 main ways it can spread: mother to child during pregnancy, childbirth or breastfeeding, injecting drugs with a needle exposed by the infected blood, infected blood donations or organ transplants, a healthcare worker who takes the blood samples of the infected patients. 36 million people in the world live with HIV. It spreads like a virus from one person to another. It can cross the boundaries, cities, states, and even countries. And it even can reach you anytime. The effects of HIV in the body. Once the HIV enters your body, it launches a direct attack on your immune system. It gradually weakens your natural defenses against disease and infections, and can affect every part of your body. Find out how. Fever, cough, rash, a strain on the heart, night sweats, muscle aches, sore throat, fatigue, swollen lymph nodes, mouth ulcers. Treatment. HIV infection is not the end of the life. People with HIV can lead a healthy life with appropriate medical care. Antiretroviral therapy ART effectively suppresses the replication if taken at the right time. Medication thus enhances both quality of life and longevity. AIDS can be defeated today more than ever. Awareness and early diagnosis will certainly help to save more lives. Please visit India Medical Hub and share this video to help create awareness. Let's help to create awareness for HIV-free generation.
There's a place, your heart, and I know that it is love. And this place will be much brighter than tomorrow. And if you really try, you'll find there's no need to cry. In this place, you'll feel there's no hurt or sorrow. There are ways to get there if you care enough for the living. Make a little space, make a better place. Heal the world, make it a better place for you and for me and the entire human race. There are people dying if you care enough for the living. Make a better place for you and for me. If you want to know why, there's a love that cannot lie. Love is strong, it only cares for joyful giving. And if we try, we shall see. In this place we cannot feel fear or dread. We stop existing and start living. Then it feels in our words, love not grudge growing. So make a better world, make a better world. Heal the world, make it a better place for you and for me and the entire human race. There are people dying if you care enough for the living. Make a better place for you and for me. And the dream we were conceived in will reveal a purple face. And the world we once believed in will stand again in grace. Then why do we keep strangling life when this earth crucified the soul? That was plain to see this was heavenly.
Save this world so precious, so blessed and so dear. Protect its beauty and splendor, don't let that disappear. Preserve our animals and plants and humankind as well, so that our future generations can have a story to tell. Protect us from evil and spread the word of good, of peace, love, justice, virtue and brotherhood. Cause we only have one earth and we can't waste our motherland. So let's move as one force. I think it's time to take a stand.
We could fly so high and let our spirits never die. In my heart, I feel you are all my brothers. Create a world with no fear. Together we'll cry happy tears. Watch the nations turn their swords into plowshares. We could